Hello, and welcome to our exclusive press preview, where we'll share an overview of key findings from Hoya Vision Care's new groundbreaking myopia control spectacle lens study based on the D.I.M.S technology. So, without further ado, I would like to introduce you to the panelists here today. John Goltermann Lassen, the CEO of Hoya Vision Care, who will talk about the Hoya's vision and commitment to myopia management. Kazuma Kozu, the R&D Director at Hoya Vision Care, who will share the R&D innovation story and partnership with the Hong Kong Polytechnic University in developing the D.I.M.S technology and its evolution into MiYOSMART IQ, which we're talking about today. Dr. Natalia Vlasak, the Global Head of Medical Affairs and Scientific Affairs at Hoya Vision Care, and Professor Chi Ho-to, Visiting Chair Professor of Experimental Optometry at the Hong Kong Polytechnic University, who will present this exciting new data and the clinical findings for you today. And Professor Serge Reznikov, the Chair of the International Myopia Institute, who will talk to the unmet needs and the global myopia challenge. Now, I would like to hand over to John Goltermann Lassen, the CEO of Hoya Vision Care.
Thank you very much, Nina. For over 60 years, Hoya Vision Care has been a global leader in the eyeglass lens industry, providing innovative vision care solutions for every stage of life. At Hoya Vision Care, we imagine a world without myopia. Our commitment is to improve life through vision by advancing science-led solutions that make a meaningful difference for patients, families, and eye care professionals worldwide. Today marks an important milestone in that journey. Since its launch in 2018, more than 15 million MiYOSMART spectacle lenses have been chosen by parents in over 50 countries, supporting children with progressive myopia around the world. Over 100 peer-reviewed publications have demonstrated the efficacy of MiYOSMART's D.I.M.S technology in protecting children's vision. Building on this strong foundation, we are now introducing MiYOSMART IQ, representing the next step in our continuous innovation in myopia management. We have brought you here today because the results we are about to share represent a significant step forward in myopia management. They reflect years of dedicated research and collaboration and highlight the progress we are making in advancing solutions for children affected by myopia. These findings reinforce our belief that innovation, grounded in science and craftsmanship, can continue to raise the standard of care and make a real difference in children's lives. Thank you, and back to you, Nina.
Thank you, John. It's really incredible to hear about Hoya's vision and commitment to stop and prevent myopia progression, and actually the millions of children that have benefited from this D.I.M.S technology. It's great to also hear about the journey so far, and actually also now how it all started in the partnership with the Hong Kong Polytechnic University. I'm pleased to introduce Kazuma Kozu, the R&D Director at Hoya Vision Care, to talk about this partnership, the evolution of the D.I.M.S technology, and the MiYOSMART IQ spectacle lens design.
Okay, thank you, Nina. The starting point of D.I.M.S technology was our collaboration with the Hong Kong Polytechnic University, which began in 2011. At that time, myopia control contact lenses already existed, but no spectacle lenses demonstrated sufficient efficacy. Through our close partnership with the university, we are able to gain crucial scientific insights, even though the lens design itself was highly unconventional. Frankly speaking, the early D.I.M.S prototype looked quite strange because introducing the focus segment onto the spectacle lens went against the fundamental principle of traditional optical design, which had always focused on clarity and natural vision. I remember that many people reacted with hesitation, and some others questioned whether the project would succeed in the future. So in those early days, both the idea of D.I.M.S and the project itself were fragile. What made a real difference was strong support from senior management, which clearly reflects our core part of Hoya's DNA. And that support allowed the team to keep thinking differently and stay committed to innovation, and ultimately it made D.I.M.S technology possible. With the successful launch of MiYOSMART in 2018, we have become a pioneer in myopia control spectacle lenses. Of course, our innovation journey did not stop there, and our next challenge was very clear. That is, how could we further enhance the efficacy of MiYOSMART, which is already delivering very strong results? And our answer to this challenge is MiYOSMART IQ. MiYOSMART IQ, due based on the groundbreaking D.I.M.S technology of MiYOSMART with a refined triple enhanced design, or TED. This triple enhanced design consists of three key elements. First, we extended the treatment coverage by adding more defocus segments to ensure a broad myopic defocus signal. Also, we made the signal more powerful by increasing the defocus power of treatment segments. And finally, the defocus segments are positioned closer to the center of the lens with the intention to continuously activate the near peripheral retina. Through a comprehensive review of scientific literature, we found some studies support our design idea. A recent study, first on an animal model, then on a young adult, found that the near peripheral retina is highly sensitive to the myopic defocus signal. One study even stated that the near peripheral retina may be a sweet spot for the detection of myopic defocus that can help control eye growth and support long-term vision development. Our children's lifestyle today are becoming increasingly diverse, and we always aim to stay close to the needs of our users. This is what we call thoughtful innovation. And today, we are truly proud to introduce MiYOSMART IQ and share the result with you at this special event. So that's all from me. Nina, back to you. Thank you.
Thank you, Kozu-san. And this 15-year innovation journey continues to really evolve. And I'm actually really excited to now hand over to Dr. Natalia Vlasak, the Global Head of Medical and Scientific Affairs at Hoya Vision Care, and Professor Chi-Ho To, who is the visiting chair professor of experimental optometry at the Hong Kong Polytechnic University, where this all really began as well, and the lead researcher to present the embargoed new study and key findings of MiYOSMART IQ.
Thank you, Nina. Can you please move the slides?
It began in 2012, a bold idea, sparked by a simple yet powerful question. How can we change the course of progressive myopia? The answer was MiYOSMART, Hoya's pioneering solution that shaped the field of myopia control. Powered by revolutionary, patent-protected and clinically proven D.I.M.S technology, and backed by more than 100 scientific publications. Trusted by eye care professionals, parents and children in more than 50 countries. We continue to drive our innovations with the latest scientific discoveries, anchored by our long-term partnership with the Hong Kong Polytechnic University. Now, it's time to raise the bar again, because at Hoya, innovation never stops.
What makes our MiYOSMART D.I.M.S spectacle lens so unique? First of all, it was first in the world spectacle lens design for myopia control, which has defocus segment on the front surface, and it has been launched base already in 2018. The next one, of course, the D.I.M.S technology. Revolutionary defocus incorporated multiple segments technology. The third one, we have more than 100 publications which shows the performance of D.I.M.S spectacle lens, of MiYOSMART spectacle lens in different age groups, in different populations, in different ethnicities, and the longest clinical study on myopia control spectacle lens running up to date. It's already trusted by eye care professionals in more than 50 countries. More than 15 million, if you can imagine, 15 million MiYOSMART spectacle lens has been already purchased by parents across the world. And we really were proud about this, that MiYOSMART has been recognized as a brand which really meaningful for both for eye care professionals and also for the parents of myopic children. Right now, we have a new design, MiYOSMART IQ D.I.M.S spectacle lens with triple enhanced design. And you know that if new medical device with treatment effect before using in humans, it should be tested. And this testing process include usually very structured steps. Phase 1. Of course, we need to understand if our new design, MiYOSMART IQ, is safe. Of course, we perform and we evaluate if there is any effect of MiYOSMART IQ on visual performance. And what came out of the study, the children can accept, the children can adapt, and children can wear the lenses, and there was no impact on visual function. We move forward and we tested if the new MiYOSMART IQ is effective. And we conduct the short-term evaluation of choroidal thickness. And in this case, we know and it's believed that choroidal thickness is believed to be a biomarker for the myopia control, for myopia progression. And we saw a great results. Right now, I'm going to hand over to Professor Chiho, who is going to present us for the first time really exciting 12 months result for the MiYOSMART IQ. Professor Chiho, floor is yours.
Thank you, Natalia. I thank the Hoya for the long-term collaboration with the Hong Kong Polytechnic University, and it's generated very significant impact in terms of myopia control. And in here, I'm very pleased to share with you the 12-month randomized control trial data with MiYOSMART IQ in Hong Kong Chinese children with you. Now, this is an inclusion criteria of the present studies, and this is slightly different from the one that we have done previously with the D.I.M.S one. In this present trial, we have recruited children of a bit younger age, so it's from 4 to 12 years old, as opposed to the 8 to 13 in the last trial. In particular, we're looking for two components. The first one is we would like to recruit early onset myopia, and therefore in the age group from 4 to 5, we're looking for children with at least 0.75 diopter myopia or above. And for the 6-year-olds, it's 1.25 diopter myopia or above. So this constitutes to the group of early onset myopia. Those are the group that we are of concern. And for the older age group from 7 to 12, we're looking for those who demonstrated a history of progressive myopia. That is, they have an axial elongations, annual axial elongations of more than 0.27 millimeter per year, or they have a myopia progression in terms of refractions for more than 0.5 diopter myopia per year. So those are the group, as I said, are the vulnerable group that we want to demonstrate effect of any myopia control lenses. In the study, we have three groups. The first one is single vision group, and then the second one is MiYOSMART group, and the third one is a new generation of D.I.M.S and MiYOSMART IQ's group. And this flow diagram showing you the recruitment process and also randomizations of subjects. So those subjects being recruited are being randomized into three groups. So eventually, we have 64 subjects in the single vision group, we have 65 subjects in the MiYOSMART group, and we have 67 in the MiYOSMART IQ group. Let's look at the demographics. So these are the baseline demographics of the three groups. As you can see, in terms of their age, gender, baseline refraction, and also the axial length, the three groups have no significant difference. And that shows the randomization process is successful. So there's no difference between the three groups, as you can see from the p-value. I'm happy to show you and very excited to show you the result. On your left-hand side is the change of refraction. Now this is the result for all the age group from 4 to 12. Look at the result on the refractions. This is psychorepeated refraction that we have For the single vision group, the children progressed by about 0.53 diopter in 12 months. But the MiYOSMART is about quarter of diopters. And if you look at this MiYOSMART IQ now, the result is quite surprising. There's hardly any myopia progression, or you can say there's no myopia growth in this group. If anything, there is a little bit of hyperopic growth. So this is really, really good result here. And if you look at the axial elongation data on the right-hand side, single vision group, they grew by about 0.346 millimeter in the 12 months. And the MiYOSMART is 0.2 millimeter roughly. And also in the MiYOSMART IQ group, it's only grown minimally at 0.075 millimeter, which is about 30% of the MiYOSMART group and about 20% of the single vision group. So the growth is very, very small. Now, if you look at the stratified age result, so because we have three groups, so we stratify them. Now, these are the result in three different age group in terms of the stress coequivalent. Now, if you look at the 4 to 6 year olds group, the single vision progressed by about 0.63 diopter, but the MiYOSMART IQ groups only progressed by 0.22 diopter, which is about 1/3 of the single vision group, which is very, very good. The effect significant. They show a significant myopic control effect here. And when we look at the older group, 7 to 9 or the 10 to 12 years old, and you can see there is hardly any myopia progression. And as I said, if anything, there is some hyperopic growth. So there's some reversal in terms of the refraction. So this result is very surprising even to the team. We couldn't quite believe it, but this is really, really good result. The key finding is that clearly there is no myopia progressions on all the average data from all the age group from 4 to 12 in the first 12 months. And the data is so good that we are going to continue to observe it for another year. And also there's minimal eye growth on average with this MiYOSMART IQ wearing for the first 12 months in this age group. And also I highlight that the MiYOSMART IQ is really the first spectacle lens to demonstrate a clinical efficacy for very young age children as young as age 4 and above as monotherapy. So this is again first evidence that we demonstrated in the literature, I think. And of course, the full data we will be able to release it in ARVO, and we're looking forward to interact with a myopia researcher in the world to get their feedback. So that is the results I'd like to share with you. Thank you.
Every child deserves to feel confident, whether in the classroom, at the playground, or simply exploring the world around them. For eye care professionals, MiYOSMART IQ elevates the standard of care, building on 8 years of trusted results. MiYOSMART IQ, D.I.M.S technology with triple enhanced design. Together, let's raise the bar in the fight against progressive myopia.
Thank you, Dr. Natalia and Professor Chiho. These findings are truly outstanding, and it is clear that this will deliver new hope to stop myopia progression in its tracks for millions across the world. With this in mind, I have the honor of introducing Professor Serge Reznikov from the International Myopia Institute, talking about the impact of myopia in children and the unmet needs that must urgently be addressed.
Thank you, Nina. Recent evidence amply confirms that myopia is a global problem. It's even a global public health problem with some unequal intensity, some regions being more affected than others, South and East Asia being particularly affected. But the shared consequences, the consequences are the same everywhere in the world, because myopia is a very significant risk of retinal morbidity. And the risk is increasing exponentially, and there is no safe level. And I think these two elements are very important. And this is why acting early is very, very important, because there is no real regression because of a treatment. The good thing is that we have very strong evidence. But unfortunately, the access to the solutions is very uneven depending on the locations. And this is because of many different barriers that need to be overcome. And we need actually to work with the governments and with the policymakers, because individual level actions are important, but it also requires system level actions. such as, for example, integrating vision screening, particularly for very young children, particularly for preschool children. We need to have the appropriate regulation of this product and make that they are approved and made available and also be accessible. And this is a very important point because access, affordability is a very important issue. And this needs to be addressed through reimbursements and health insurance systems. Last but not the least, it's critical to work with the education sector because this is where combined integrated actions are possible. So in conclusion, I think it's important to keep in mind that acting early can prevent millions of cases of irreversible vision loss. Conversely, if we delay, the epidemic will define the next generation. Thank you.
Thank you very much, Serge, for that. We wanted to just put together a bit of a summary and closing and thanking all the speakers today and summarise before we go into questions. We know that the burden of myopia and its unmet needs require urgent addressing by policymakers, including the need to improve access to vision care and vision screening for millions of children. It is incredible to see that Hoya continues on its journey and maintaining its commitment to improving the life of vision through vision by continuing to advance innovative science-led solutions, aiming to bring an end to the burden of refractive error for all. And they won't stop here. The data is incredible to see and marks a new era of myopia control in which myopia on average can be achieved in the first year of wearing the MiYOSMART IQ. It's delivering incredible results.